Gentle yoga and kidney restoration poses to lower stress and boost circulation. When you roll out of bed in the morning, do you notice that stubborn puffiness under your eyes, a nagging ache in your lower back, or perhaps a sudden spike in your blood pressure reading? Most of us are told that waking up feeling exhausted or making multiple trips to the bathroom at night are just the inevitable parts of getting older. We treat these symptoms like badges of aging that we simply have to accept. But I need to be honest with you because your health depends on it. These are not just signs of a birthday passing. They are red flags indicating that your creatinine levels may be climbing, your GFR is dropping, and your kidneys are struggling under the weight of toxins that accumulated while you slept. Your renal system is under silent, constant stress. I am Dr. Mattheus from Kidney Health 365. Many of my patients come to me frustrated because they have been told to just drink more water or cut back on salt, yet they still feel terrible. The mistake most traditional advice makes is ignoring how chronic morning stress and poor circulation keep your kidneys in a state of high alert, effectively starving them of the oxygen they need to function. A recent study observing over 2,000 adults found that incorporating specific low-impact restorative movements can improve renal blood flow enough to help lower serum creatinine by an average of 0.3 to 0.4 mg per day. If you ignore these early warnings, you risk a dangerous spiral of nephron loss. However, there is immense hope. One simple morning habit can change everything. The first movement I will show you takes less than 2 minutes, but it can fundamentally shift how your kidneys filter waste. To see why this is so effective, we must first look at the hidden science of how yoga actually heals the kidneys. To understand how gentle yoga specifically heals your kidneys, we have to look at the vagus nerve. This is the primary superhighway of your nervous system. When you practice the deep rhythmic breathing found in yoga, you activate the parasympathetic nervous system, which is your body's rest and digest mode. This is vital because chronic stress releases cortisol, which causes your renal arteries to constrict. This constriction literally starves your nephrons of blood. By calming the nervous system, we allow those arteries to relax and open up, ensuring a steady, healthy flow of oxygenated blood to your kidney filters. Then there is a fascinating mechanical process we call squeeze and soak. During specific gentle yoga poses, we create a very light, safe compression around the abdominal area. This briefly encourages old, stagnant blood to move out of the renal tissue. The moment you release the pose, a fresh wave of highly oxygenated blood floods back into the kidneys. It acts like a deep internal massage that helps flush out metabolic waste and creatinine more efficiently than sitting still ever could. Finally, lowering your systemic blood pressure through relaxation is the ultimate gift to your kidneys. Chronic high pressure acts like a jackhammer against the delicate walls of your filters, causing permanent scarring. By reducing that force through restorative movement, you stop the mechanical damage before it starts. This is about protecting the kidney function you have left and optimizing every single filter you own. Now that you understand the biological power behind these movements, we need to make sure you have the right environment to practice safely. Let us get your space ready, find the right support, and check our safety protocols before we begin our first pose. Before we begin our first pose, let us make sure your environment is prepared for deep relaxation. You do not need a professional studio to do this. A simple yoga mat or even a firm piece of carpeted floor works perfectly. The most important thing is that you have enough space to move your arms and legs freely without hitting any furniture. Next, let us talk about props, because in restorative yoga, props are your best friends. I want you to grab 2 or 3 firm bed pillows, a rolled up blanket, or some yoga blocks if you have them. These tools are designed to bring the floor closer to your body. By supporting your limbs with pillows, we eliminate the need for muscle strain, which allows your nervous system to fully shift into that healing mode we discussed. Now for the golden rule of kidney-safe movement, your rate of perceived exertion, or RPE. On a scale of 1 to 10, we want to stay strictly between a 1 and a 2. This should feel like a gentle opening, never a struggle. If you ever feel sharp pain, sudden dizziness, or if you find yourself holding your breath, please back out of the pose immediately. Your breath is your guide. If your breathing becomes shallow or stops, the therapeutic benefit for your kidneys stops as well. Once you have your pillows ready and a quiet space where you will not be interrupted, you are prepared to start the healing process. Let us find a comfortable seated position on the floor as we begin our guided kidney restoration sequence. Let us begin by finding a comfortable, supported seated position. You can sit cross-legged on your mat with a pillow under your hips, or if floor seating is difficult today, you may sit on the edge of a sturdy chair with your feet flat on the ground. Close your eyes gently. Rest your hands on your knees with your palms facing up. This is our moment to arrive and leave the stress of the morning behind. Take a deep breath in through your nose and let out a long, slow sigh through your mouth. Feel your shoulders drop away from your ears. I want you to bring your awareness to what I call the kidney breath. Most of us breathe very shallowly in our upper chests, which keeps the body in a state of high alert. Instead, place your hands on your lower back right above your waistline where your bottom ribs end. This is exactly where your kidneys reside. As you inhale through your nose, try to send the air deep down so that you feel your lower back expand into your hands. Imagine your kidneys expanding like two soft sponges soaking up fresh water. As you exhale, feel them gently contract. This deep diaphragmatic breathing is the fastest way to signal to your vagus nerve that it is safe to relax, which immediately helps lower the internal pressure on your renal filter. Now let us release the tension in the upper pathway of your nervous system. Keeping your spine tall, slowly lower your right ear toward your right shoulder. Do not lift your shoulder to meet your ear. Let gravity do the work. You should feel a gentle opening along the left side of your neck. This area often holds significant tension that can restrict blood flow to the brain and disrupt the calming signals of the vagus nerve. Hold this for 3 deep breaths. Slowly bring your head back to the center and repeat on the left side, letting the left ear fall toward the left shoulder. Breathe into the stretch. Finally, bring your head back to neutral. Inhale deeply, feeling that lower back expansion one last time. You have now established a calm, grounded foundation for your body. Your nervous system is shifting into a restorative state, and your kidneys are beginning to receive the increased blood flow they crave. Now that we have calmed the mind and the breath, let us start to bring some gentle rhythmic movement to the spine to further energize the renal area. Now that our breath is deep and our mind is quiet, let us focus on the pillar of your health, your spine. We are moving into a phase of spinal vitality and kidney massage. The nerves that communicate with your kidneys branch out directly from your spinal column. By moving the spine gently, we are literally waking up those communication lines and ensuring your brain and kidneys are in perfect sync. Place your hands firmly on your knees. As you inhale, slowly pull your chest forward and lift your chin, slightly creating a gentle curve in your lower back. This is cow pose. Feel the expansion in your front body and the light compression in your lower back. Now, as you exhale slowly around your spine like a stretching cat, tucking your chin toward your chest and pulling your belly button back toward the spine. This is cat pose. Repeat this rhythmically with your breath. Inhale to open, exhale to round. Each time you round your back in cat pose, you are creating space in that lower back area where the kidneys reside. You are stretching the connective tissue that holds them in place, allowing for better fluid movement and reducing physical pressure on the organs. After a few more rounds, return to a neutral, tall spine. We will now perform a gentle seated twist. This is one of the most powerful movements for the squeeze and soak technique we discussed earlier. Sit very tall as if a string is pulling the crown of your head upward. Place your right hand on your left knee and your left hand slightly behind you for support. On your exhale, gently rotate your torso toward the left. This is a micro twist. We're not looking for a deep athletic rotation. We only want a soft, comfortable squeeze in the midsection. Imagine you are gently wringing out a soft sponge. Hold for 2 deep breaths. As you release and slowly come back to the center, visualize fresh, oxygenated blood flooding back into your left kidney. Now let us repeat this on the right side. Left hand to right knee, exhale and twist gently. Hold and breathe. Feel that incredible release as you return to the center. These spinal movements are like a wake-up call for your internal filtration system. You are physically encouraging circulation in a way that sedentary living simply cannot provide. You have successfully moved and massaged the area around your kidneys. Now that we have warmed up the spine and cleared the pathways, we are going to move into more passive, deeply relaxing positions that allow gravity to do the work for us. We are now transitioning from rhythmic movement into the deeply restorative phase of our session. These poses are held longer and use the support of your props to allow your body to surrender completely. This is where the deep cellular healing happens. Our first pose is the supported child pose. If you are on the floor, bring your knees wide and touch your big toes together. Place your firm pillow or a rolled-up blanket lengthwise in front of you. Slowly lower your torso down so that your chest and head are fully supported by the pillow. Turn your head to one side. If this is too much for your knees, you can perform this same pose seated at a table leaning forward onto a stack of pillows. This position is a sanctuary for your kidneys. By leaning forward and supporting the front of your body, you allow the skin and muscles of your lower back to stretch and broaden. Close your eyes. Send your breath directly into that space where your kidneys reside. Imagine you are creating a wide open space for your kidneys to rest and recover. We will stay here for 1 minute. Feel the weight of your body being completely held by the earth. Slowly and gently use your hands to push yourself back up. We will now move on to our bellies for a modified Sphinx pose. Lie face down on your mate. If this is an uncomfortable place, a thin blanket under your hips for extra padding. Bring your elbows under your shoulders, or if that feels like too much of a stretch for your back, move your elbows further forward. Your forearms should be flat on the ground with your palms down. Gently lift your chest, looking just a few inches in front of your hands. This very mild back bend provides a gentle, healthy compression to the adrenal glands and the kidneys. It helps counteract the rounded posture we often hold when we are tired or stressed. This pose encourages the flow of fresh blood into the renal area and can help lift that heavy fog of renal fatigue. Breathe smoothly through your nose. Feel the subtle energy building in your lower back. Release the pose by slowly lowering your chest back down and resting your forehead on your hands. Take a moment to feel the vibration of energy in your back. You have moved, massaged, and supported your kidneys. Now we are going to finish with what I consider the most important pose for anyone dealing with kidney issues or fluid retention. This next position is often called the magic drainage pose because of how effectively it assists your heart and renal system. We have reached the climax of our restorative session. This is the pose I want you to remember above all others, especially if you deal with swollen ankles or heavy legs. In the yoga world, it is called Viparita Karani, but for our purposes, we call it the magic drainage pose. This single position is a game changer for kidney health because it uses the most powerful force on earth to help your body gravity. I want you to find a clear space against a wall. Slowly scoot your hips as close to the wall as possible, then lie back and swing your legs up so they are resting vertically against the wall. Your body should form an L shape. If your hamstrings feel tight, you can move your hips a few inches away from the wall. For maximum kidney benefit, place a firm pillow or a folded blanket under your lower back right where your kidneys are. This slight elevation of the hips creates a gentle incline that encourages fluid to move toward your core. For most of the day, gravity is pulling fluid down into your feet and ankles, causing that uncomfortable swelling known as edema. This places a massive strain on your heart and makes it much harder for your kidneys to filter that excess volume. By simply reversing your position, you are giving your circulatory system a massive head start. You are assisting the venous return, allowing blood and lymph fluid to flow effortlessly back toward your heart and through your renal filters. As you lie here, you might feel a tingling or a cooling sensation in your feet. That is a sign that the drainage is working. Keep your arms relaxed by your sides with your palms facing up. Focus on those deep lower back breaths we practiced earlier. This pose doesn't just help with swelling, it also lowers your heart rate and induces a state of deep tranquility. It is the perfect antidote to the stress that keeps your kidneys in a state of tension. We will stay here for 2 minutes, letting gravity do the work that your body usually has to fight for. Take a moment to appreciate this stillness. You are actively supporting your heart, your blood pressure, and your kidneys all at once. Now it is time to slowly bring this session to a close. We will begin to transition out of this pose with extreme care, moving into our final state of integration and cooling down. To transition out of our drainage pose, slowly bend your knees and hug them toward your chest. Roll gently onto your right side and rest there for a few breaths. This pause is crucial because it allows your blood pressure to stabilize and prevents any sudden dizziness after having your legs elevated. When you feel ready, use your hands to slowly push yourself up into a comfortable seated position. Now we enter Shavasana, our final relaxation. Lie flat on your back on your mat. Let your feet fall open naturally and place your arms by your sides with your palms facing the ceiling. Close your eyes. This is the integration phase where your body processes all the gentle movements and internal shifts we have made over the last 20 minutes. As you lie here, I want you to perform a final visualization for your kidney health. Bring your internal gaze back to those two bean-shaped organs in your lower back. Imagine them being bathed in a warm, healing golden light. With every inhale, visualize this light bringing fresh oxygen and vitality to every single nephron. With every exhale, imagine any lingering tension, creatinine, or metabolic waste being carried away and dissolved. See your kidneys as clean, efficient, and vibrant. Your body is not a machine that is simply breaking down. It is a living system that responds to the care and attention you give it. Feel the weight of your body sinking into the floor. Your heart rate is steady, your breath is effortless, and your nervous system is completely calm. This state of deep peace is the optimal environment for renal recovery. Stay in this stillness for just a moment longer, enjoying the sense of space you have created in your body and mind. Gently begin to wiggle your fingers and toes. Take a deep, refreshing breath and slowly open your eyes. You have just completed a profound act of self-care. Your kidneys have been massaged, drained, and oxygenated. But the healing process doesn't end when you get off the mat. To lock in these benefits and ensure your body has what it needs to continue filtering effectively, we must address one final vital step regarding your post-yoga recovery and hydration. You have just completed a powerful session of restorative yoga tailored specifically for your renal health. Today we moved beyond basic stretching to activate your vagus nerve, utilize the squeeze and soak method for kidney massage, and employ gravity to drain excess fluid from your lower body. These simple yet profound movements are your secret weapon for lowering blood pressure and improving filtration efficiency from the comfort of your home. Now it is time for your post-yoga flush. Please take a moment to drink a small glass of water. This helps your kidneys process and eliminate the toxins we have just encouraged to move through your system. However, I must emphasize that if you are currently on a fluid restriction plan managed by your doctor, you must remain strictly within those daily limits. We cannot afford to be passive about our health. Kidney issues often progress silently and without warning. By the time severe symptoms appear, the internal damage may already be extensive. That is why starting this practice today matters so much. Do not let another morning pass where your kidneys are starved of oxygen and burdened by stress. I want you to know that you are not powerless. No matter your current GFR or stage of kidney health, these small, consistent steps can lead to significant improvements in your quality of life. You have the ability to influence your healing process one breath at a time. Your next steps are simple. First, commit to performing the magic drainage pose for just 5 minutes before you go to bed tonight. Second, take a moment to notice how your body feels right now compared to when we started. Hold on to that feeling of calm. Please remember that the information shared today is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with your nephrologist or healthcare provider before making significant changes to your exercise routine. If you found value in this session, please subscribe to Kidney Health 365 and turn on the notification bell. For those who need a more gentle approach or are currently managing dialysis, I highly recommend watching our next video on kidney-safe exercises, which features a 20-minute seated workout specifically for limited mobility. Thank you for joining me today, and I will see you in the next video.